Dr. Pannozzo is the one you guys need to call, and make that call today because living in pain is no way to go through life. Dr. Pannozzo has been in practice now for more than 49 years. He's treated more than 73,000 patients for pain. He's an expert when it comes to diagnosing the pain, and he has had huge turnarounds. In fact, people living with scoliosis, he has had nearly a 100% turnaround. Lumbar pain as well. If you've got lower back pain, if you're suffering with migraines or flat feet pain, maybe pain in your elbows, your neck, your shoulders, Dr. Pannozzo can help you. And the greatest thing is he can help you without drugs, without surgery, and without having to go through weeks and months of rehabilitation. Give him a call today. Set up an appointment. It's 561-381-5800. Tune into his show Sundays, 11 to noon. And now, here's this week's edition of the Dr. Pannozzo Sports and Medicine Hour.
Good morning, South Florida. I just got to ask you guys a question before. Do you feel that we were here yesterday? Did this Sunday go by so fast?
It's going by faster and faster.
Freddie,
I'm getting older and older, quicker and quicker.
The earth is warming up faster and faster.
Well, all I know is I saw Gio when he was a little kid. Now look at you. He's all grown up and he's running our computer stuff. So, first of all, good morning, everyone. I hope everyone had a great weekend. The playoffs are here, and if they would have seen Dr. Pannozzo, a couple of those guys would have still been playing. I want to say hello to our producer, Mr. Centauri.
What's the name of your producer?
Our producer's name is Freddy Santori of AM2.
Oh, today it's Freddy Santori. What's the name of the lady behind?
Winter Cody.
Oh, very good.
Linda,
how are you, Linda?
He must be taking his fish oil.
Taking his fish oil.
And we have Gio here. He doesn't say well. He just runs.
Guy's behind the mob here.
Yeah, he's the guy that keeps the show going. I want to say hi to New York. I think thank you so much for all the calls you've been writing in.
New York.
I hope you're enjoying seeing Dr. Pannozzo and myself. And we don't show Freddie because he's wanted. So, Freddie, just keep that anonymous thing going. If you want to talk to Dr. Pannozzo directly, you can call him at 800-889-0267. We take all calls. 800-889-0267. If you're planning on coming down here from Manhattan or Atlanta, give Dr. Pannozzo a call at 561-381-5800. And now we're going to start our show.
Hold on.
What?
Website.
Website. Oh, wait, that's right. If you want to write into Dr. Pannozzo.
We want you to write in.
We want you to write in.
We are looking for write-ins.
Okay.
Yes. Or call-ins
Dr. Pannozzo.
Right. Pannozzo, Pannozzo.TV.
Right.
And you could write in your questions, and Gio and Mr. Centauri will be more than happy to answer those questions every Sunday. Or if you want to, we'll answer them the day you send them in.
We're also going to see if Dr. Pannozzo will be good enough to give us a blog. He's going to talk about the industry,
right?
What he does, so that people can write in and get copies of his book on there.
Yeah.
What's the name of the book, Doc?
Here it is. Arthritis and Other Pain Syndromes right there.
And there it is. And you can
This
go to
is
Pannozzo.tv to get
all the secrets that I talk about are in this book.
Wait a second, Doc. If all these people learn the secrets, no, they can't do what you do.
No, this explains the secrets.
Oh, okay.
They can't do them, no. But
and the doc doesn't usually
trying to keep me on the right.
Yeah.
He usually doesn't worry about you knowing what he does because nobody does it the way he does.
No one does it.
Yeah, that's true.
You know what, Freddie? This is something funny, Doc. I want to ask you a question. This is always something. These guys that have ads in newspapers, pain management. What's the difference between pain management and what you do? Because a lot of people want to know that.
Well, we don't do pain management.
Okay.
Pain management entails giving you drugs to keep the problem that you have under control. We don't like that idea at all.
So we don't give drugs.
No,
you don't give
no drugs at all. Aspirin is the main drug you get. And well, we know where the sources are, so I don't have to prescribe anything. We get rid of the source of the pain. If you let me do my work, you walk out of that office with that pain reduced or gone forever.
Now, Doc, that doesn't
Forever.
mean you're going to make everybody happy. Okay,
Yeah.
let's be real about this.
Okay.
It doesn't mean that everybody's going to walk in there happy because you're not getting medication. You're doing something different from everybody else. If you want to continue to make the same mistakes over and over, then don't come in. I mean, simple.
Well, that's kind of like my attitude is. When you walk in the door, this is a completely different system, and we take our own history, do our own examinations, and we don't want to know what the other guy did because he's failed.
Right.
Failed you.
That's right. Leave what the doctors have been doing at the door. Please do not bring in your MRI.
Please do not bring in your MRI.
There is
Please.
no need for them.
And don't give this report of your.
Actually, the X-ray analysis that we do, I have a patent on it, and it is far superior than an MRI. MRIs are good if you're looking for things. I mean, I had one myself the other day, and they didn't find anything wrong, so it was a good thing to do. But on a musculoskeletal system, you have to have a history, and you got to know what you're dealing with. Where is the pain? When do you get it? Why do you get it? You know, and then we do our special analysis we do on the film and the clinical exam. Then we come up with a diagnosis. So we'll tell you, this is what's bothering you, and this is why it's bothering you, and this is what it takes to get rid of it right now.
So how many people does the patient have to see before they get to see you?
They see no one else. They only see me.
Beginning to end.
And you know what's amazing about that, Freddie? When have you called up your doctor and he's answered the phone?
Never.
Okay. You should get someone that says, well, you know, you're going to call at 4 o'clock in the morning. Picked up the phone from New York. Thank you so much for calling. And
That's true.
I mean,
Well, you know, but the nice thing about that, Doc, is that you are the one that you can hear the person's pain right from the jump street.
yeah.
And you can already size it up, because I've seen you do it in the studio. You can size up where it's going, where it's coming from, and you know more or less of where to look.
Yeah, we give the person a little bit of a hope. Remember, all these pains that are so severe are mainly ligaments, and they're very small. And I know where they are. I've seen so many people, 78,000 people maybe.
74,000.
70, no, that was 74 was a couple of years ago.
Oh, we've got to change the commercial
Oh,
again.
it goes up every day.
I know. It's almost impossible.
And people have been coming to the office because we see spikes in the numbers, and people
Yes.
are coming, and they're getting serviced, and it's there. All I'm saying is, if you bring an attitude that I want medication, because that's a sign of healing,
No.
change your view, because that's not a sign of
Now, if you want a bedside manner,
You're not going to get it there.
Listen, you're not going to get a bedside manner. Sorry about that. I've been trying for 2 years.
He's not going to say, hey, you're doing a hell of a job.
no, I have a bedside
Yes, you
manner,
are.
but it's not it's not emotional.
Right.
So
It's scientific.
He doesn't want any friends. He just
He
wants
looks
to
at you like you're a test tube.
treatment of the pain problems. In other words, if you can get rid of the problem, you must know something. I mean, it's a science. It's science. What is a science anyway? You know what a science is?
Science is finding what caused something and being able to treat it. Is that good?
No.
Okay.
Science is what Dr. Pannozzo is about to tell us.
Why did you tell us, Doc, what a science is?
Why don't you tell us, Doc?
Okay, that's a good idea.
You know, I've been out of college now for, I don't want to tell you folks how long, but if you can look on the screen
Well,
and see, it's been a while.
In simple terms, a science is predictable.
Oh, that's the word I keep
There
forgetting.
you go.
Predictable.
Now, if you can read the future and it comes true, then that's
real
That's a
science.
science.
See,
yeah.
that's good.
And reproducible. In other words, if you say, well, I've seen this pain before and we can knock it out. Reproducible and predictable. So those two things, and that's what we do every day.
Well, I have a question that was sent in from somebody from Miami. They wanted to know if it's the same setup, the same cure for everybody that has that particular ailment. In other words, if everybody in this room came to see you with the same problem, do you treat it the same way?
No, because everybody's different.
Right.
So
Yeah, so
the
it's like-
basic pain pattern may be there, but what's producing it is going to be different on everybody. So that's the other aspect that you have to know when you come to my office. You're going to get the scenario of how you got it. I mean, I've told people that you fell 20 years ago, and here's the evidence. They say, I never fell, but there's the evidence of it.
Anyone that hasn't fell in 20 years is
And
living
when
in
you
a
get
box.
this, you get scar tissue, and the pain is coming from here. So that means that you're getting overusage on a part of it. And so you have to take care of the scar tissue before the other part will go away. So that's a scenario that's based on the science, based on the history, clinical exam, the film, and then predicting the future. And that's the kind of work we do. So in order for you to have that pain knocked out on the day you're there, you got to know all this stuff, and you got to have a free rein. In other words, You can't say, well, I don't want any shots. You can't say, well, my doctor didn't say that. You know, you're in the wrong place if you have that kind of attitude.
Let's talk about the shot for a second. A lot of people ask me, "Oh, what's in the shot?" And I know it's a mild. I know what's in the shot.
It's not important what's in it. It's
Right.
why and where you use it. That's
How
important.
you use it.
Right.
And why and where and how you use it. People don't talk about that. You know, you don't get a textbook thing here, like somebody comes in and you get an epidural. Everybody gets the same thing. No, it's not. Everybody's different. You get exactly what's causing the main problem, the symptomatic part, and the other part that's causing that. You get it all done at one time.
That's important to realize because every person is different. So the healing process is going to be different.
Of course.
How he approaches that particular person is going to be different.
It's going to be different because based on the history, based on the clinical exam, and what happened to that person through the years. I mean, you know, people forget what happened.
Well, it's always funny when anytime anyone's gone to any kind of a doctor, because I've been, we've all gone to a lot of doctors. No one ever asks, how did this happen to you? He wants to find out what the cause was that caused this injury,
right.
and the effect, and he's able to take care of that, which I've learned. Freddie and I, before we even met you, we always tell people, we sat in your office. Well, we didn't sit in your office. We had to sit outside on the stoop because your office was pretty well full. And people, and you listen to these people unsolicited telling how great you are, and I'm saying to Freddie, I got to see this guy to see what this is. We were totally amazed, and I always tell people, if you don't believe it, come on in, sit in the office, go in and talk to him.
Well, this is why we're on the radio today.
Yeah.
This service that we offer is
Yeah,
not
it's-
offered anywhere.
No.
If somebody says, well, I don't know what's wrong with you, let's get an MRI, walk out of there and don't go back,
Right.
because that doctor does not know what he's talking about. He's depending on a radiologist to make a diagnosis for him. Don't do it. Surgery is done that way. I mean, if you go get an MRI of a knee, they'll diagnose a tear. So that means you can get operated. Don't do it. Don't get MRIs of the shoulder or hips or knee.
Well,
at all.
I just
They're
saw
misread.
I just saw a documentary from ESPN about concussions in the NFL.
Oh, I'm glad you said him and I were talking about the goal. Tell me, okay.
Did you see that?
Yes.
And it's funny because now they're ruling out using an MRI to diagnose concussion, and they're moving from the rattling of the brain, which is what they say is the concussion, to now they're working on the spine. So the injuries
they're not going to get it. I'm going to tell you right now, because it's the same doctors who missed it over the period of years, so how are they going to get it? We come up with that last program.
That's right.
We told you exactly where it is and exactly how to get rid of it.
I have a feeling somebody was watching that program, Doc,
well,
because all of a sudden they called out what you said last week.
I mean, look, if someone gets hit in the head, okay, I remember you telling me the head is so strong that it's almost impossible to do any damage to the head.
Yeah, it's a hydraulic system.
Right.
You can't hurt it.
So it's got to be the neck that's moving back.
It is the neck.
And that causes the...
But which part, though?
That's the thing, yeah.
But what happened?
You answered your own question.
But what ended up happening is until last Wednesday, they were talking about concussion in the brain. Now it's the rattling. They used to say there was blood in there, which is not necessarily true. But now they said an MRI will not, this is the key, tell you if you have a concussion. It used to be, let's take an MRI.
No, a concussion is just a term. What does it mean?
Nobody knows.
No.
So what he said is true.
Yeah.
Now they're working on, Doc, you should give these doctors a head start and tell them again where it is.
He would love to, to do that, but for some reason the doctors are afraid. Here's my feeling: I think they're afraid that, and this is just my feeling, that it's going to take clients or revenue out of their
Well, look,
pockets.
if you're a professor and you're on a medical school staff
Right.
and all that, you're teaching all the same stuff all the time, and I come along and say that's not teaching is not exactly right. This is what you should be teaching. They say, whoa,
Yeah.
they're very reluctant to cede that kind of knowledge to other people. I mean, it's a serious problem. It really is.
But Doc, you can be reluctant, but you can also be wrong. You understand what I'm saying?
No, I can't.
Doctors can be wrong. They've been
We're
wrong.
not saying you.
Not you,
Oh, not
them.
me. Oh, them.
They could
yeah.
be wrong. They're reluctant to learn something new. But at the same time, that reluctance
Well,
is
if-
costing people's careers.
Well,
gotta
if-
listen to
if
what we
it's-
say, Doc.
Well, if it's not written by somebody they know from another medical school, then it's kind of hard for them to understand that this guy in Delray Beach, Florida, me, know something, and you got to listen because I get the results that you don't get.
Well, I believe
We
that.
had no therapy, no chiropractic, nothing like that.
Just to let everyone know.
Just me and the patient. So what do I know that these guys should know?
But I
They should
believe he's an MD, correct?
Yeah.
Well, he's an MD graduated from the
Yeah.
Big O.
The Ohio State.
Ohio
And
State.
we're only strangers for the first 2 seconds. So if
Right.
I'm an MD and I write something and we're strangers and you
Right.
read it, we're no longer strangers.
No.
Now we're colleagues.
Yes.
So if you have a cure to something, that stranger bit only takes 2 seconds.
Well, I
After
tell you,
that,
we have Dr. Rosenblatt now
Yeah.
in Delray who detoxifies people. You know, you take narcotics, you go to him. He refers to me because I get rid of the pain. There's a what do you call it?
Synergistic relationship.
It is, but it's
Whoa.
not. We don't hold hands though.
No.
He refers them over. We do the job we do.
what did
and
he say?
Synergistic relationship.
God.
He's used a big word.
That's
I'm
a
sorry.
big. Lynn,
Lynn,
call the fire
like that
department.
word, synergistic?
He's on fire.
I've been waiting a year to use that word.
He's on fire today.
So here's a doctor that's pain. We understand but these like the VA hospital is not treating people the way
Veterans.
they should.
Veterans are not treated
they're not-
as they should.
And God bless them for what they've done for us.
And we thank him for their service.
Yes, we do.
And we should have an opportunity to have Dr. Pannozzo help these vets.
He could.
Because he can remove the pain and they won't have to be on drugs. And that's a big one.
Yeah,
That's a big
lot of
deal.
vets are on drugs because the pain is so severe. And here's a man,
There is no pain big enough for narcotics. Absolutely not. If
It
you know
works
how
on
to
the brain.
diagnose
That's all
it,
it does.
you know that it's not true.
And it just escalates. They
Yeah.
start small drugs
Well-
and they get the big drugs.
Well, yeah, but then the patient loses faith in his doctors and his society
That's
because now he's going downhill. He doesn't know what to do.
it happened to my daughter's husband, may he rest in peace, with the back problems before I knew him.
Well, this is what I mean by sometimes not realizing or not taking the chance on learning something new could be detrimental to a lot of people.
Of course.
So take a chance.
Hey, look,
Well,
you can go
they-
for surgery anytime you want, but before you go for surgery, there's an alternative.
In the VA, they're not going to refer out. They're not able. They're not permitted. to
Okay,
refer
so
out.
then I walk in to the VA and I take all those vets with me. I said, everybody follow me, and I'll take care of it myself. Well, you know, Doc, the bottom line here is that you got to start a revolution somehow. And if wrong is wrong and wrong is wrong. My old man used to tell me, when you're wrong, man up, admit you've done something wrong, and try something else.
But they don't want to.
I don't care what they want.
You know, it's a funny thing. Until you've experienced him as a doctor and seen what this man can do, you look in the mirror. You know what you say to yourself? Why the heck did I wait this
That's
long
right.
to see this guy?
That's right. Then all of a sudden, it doesn't matter what they want.
No.
What matters is what they do.
We had some really interesting cases this week. I should write these things down.
You should, because
You should.
it
You
will
should
be
have
nice to
somebody
hear
in there
what you
writing
do.
them, Doc.
I
We
mean,
had a guy, really tall guy. He had a pain in his back, and he went to 10 doctors. And had all kinds of things, epidurals, treatments, all kinds of stuff. I took that pain out one day. One day.
why it take you so long?
Yeah, what took you so long, Doc? How long was he visiting doctors?
He saw me one day and he couldn't believe it.
How many years was he seeing doctors, or what period of time?
Oh, 10 years.
Now you ask, what took you so long?
Well, the thing is, I have people that I brought in that are friends of mine, and they looked at me and said, "Holy, I got to use the right word.
Holy mackerel.
Holy mackerel smokes and whatever. I can't say the other word. I feel a guy that was my brother-in-law's best friend. He's a golfer. Everywhere he's gone, everywhere he went, he saw him, I think, twice. One week, and they came in with something else.
That's right.
And they look at me and say, "Where the hell has this guy been all these years?"
I've been suppressed.
Well, you know, I have.
Thank God for radio and what we're doing, and iHeartMedia. God bless you. We'll pay our bills
I've
this
had
week, okay?
emails from people in New York that are calling their retired folks here in Florida,
Yeah.
asking them, "Do you know this Dr. Pannozzo?" No, we don't. But Mom, Dad, you're going to the doctor how many days this week? Monday, Wednesday, Thursday, Friday. That's his schedule. They're going to the doctor, 5 different doctors,
Yeah.
5 different pains. That's what their life is like. When they can come see you, like the guy that did it for 10 years, and resolve the issue.
Pain's not fun, man. Well, look at you.
That's right, look at me.
How long did it take me to convince you to come see this? Well, I want you to go first.
Well, you had me go first.
Why not?
What are you talking about?
I'm an important guy.
You want to read some questions over here?
Doc, I'm the MC.
Oh,
You're the doctor. He's gonna keep it. Okay. I'm gonna read some. A guy pays me. I should be nicer, shouldn't I?
Yes, you
okay.
should.
Okay, here we go.
You finished last
Wait a
week's
minute,
question?
did I pay you? I didn't know that.
That's where the check is missing. Okay.
Did you read last week's
Did I
question?
did I finish last week's question? Was the question?
No, he does this because he likes it. Believe me, there's all of these guys.
Well, I like it because I like helping people. I like people to know that there are alternatives to.
So what you're hearing are true stories. I mean, we don't make anything up. We don't have to.
And the funny thing is that half the stories you hear are just amazing. You told a
Well,
lady.
there's more. I had another guy this week had a groin pain, both sides.
Hey, I had that.
He had his lower back operated, his hips operated. He still had the groin pain. And his son brought him in to me because he said, "This is the last resort. I mean, we try to get rid of this pain." All it was scar tissue in the groin. Took one shot on each side, and he walked out with less than 50% pain remaining. Now remember, when you're operated, there's a lot of scar tissue.
Right.
And he came in the next day, got rid of the rest of it, and he flew back home to New York.
How many shots did I take for my groin?
One,
Thank you.
two.
Oh, one. Yeah, right. Two.
There were two different
That's
spots.
amazing.
Yeah.
Think about that too. And I could.
But see,
if I was
now you ask, why is that possible?
Right.
Because when you go to surgeons, you're getting a surgical approach. They do not do treatments.
Right.
They don't know how. They're not trained in it. I'm trained in it. I'm not trained in surgery though, although I could probably do it. But we don't want to
do it, Doc.
But we don't want to do surgery.
That's right.
We want to do treatments, so you don't need surgery. So that's what we did. That's the difference. So when you go to a surgeon, you're getting a surgical approach. Remember, you're asking the guy to do something that he's not equipped to do, which is treat your source of your pain. He's going to operate you. So if you want that, that's fine. They do a great job. But if you want to get rid of the pain, don't go to the surgeon first. I mean, I had somebody come in the office and had 5 different opinions on what he should do. I said, "You went to 5 surgeons, didn't you?" He said, "Yes." I said, "I mean, of course you're going to get the same kind. They're trained the same, and they do a legitimate job. But if you don't need it, try something else."
In other words, before you, here's my feeling, folks, and this is just mine. I think, Fred, you'd agree that before you go in for surgery, okay, go see Dr. Pannozzo. There's well, let me put it this way: there's a 90.9999 chance that you don't have to go to surgery.
Right.
Okay.
I think you should forget about the surgery altogether.
Well, I mean,
I'm
you
just
should
so tired of this.
Yeah, you should go in there. I mean, why? My brother-in-law now was coming to him after he saw the show, and he said, "Wow." And you know what I told him? When you want to look up about Dr. Pannozzo, we just went through the whole thing. Not one single bad
Well,
thing
what
to
is
say.
it? Where do you look?
You know what my wife did? It's a medical site that has every doctor and every profession. They can find it. Go to medical. They put your name in, and it'll pop up.
Yeah, there's a lot of those, and you got to be careful because they don't verify fact.
Right.
You want to make a complaint, they'll write it down. They'll show it. Then you say, "What are you complaining about? You got rid of the pain, didn't you?" "Well, you don't have a bedside manner." What? That doesn't matter.
You have enough friends. Before I go to questions, you know what I saw on TV? This thing about cell therapy.
Cell.
Yeah, where they could take stem cells.
Stem cells.
Stem cells and
Well,
get rid of back pain and migraines.
The new institute here in Fort Lauderdale.
Yeah, I know. That's where the question was.
Stem Cell Institute.
There's 2 or 3 companies, right?
Yeah.
Yep.
There's all
that
over.
came
There's
to
one in
town.
Boca.
It's a scam. Do not do that. I am on record right now. Stem cell therapy is a scam. Do not do that. Stem cells are only important before you're born, not after.
Wow.
No,
Because it goes back to what's causing the pain anyway.
Yes.
You know, if you have a shoulder pain, you don't want stem cells for that. You want a steroid to take the inflammation out.
Yes.
That's cheaper and better and right on.
Well,
not stem cells.
I had a new one for you this week, and this is what my son is screaming over here in the corner. CBS News reported, you can look it up, that doctors are saying now that your stem cell growth stops at the age of 25. That's it. They could become dormant. Whatever that means, Doc. Don't look at me like I know what I'm talking about.
Age of 25, that's
yes, stem cells stop.
Much later than it's possible.
Okay, so they're saying that if you are able to get stem cells, a specific type of stem cells, and inject it into somebody who's over 50, it will reawaken dormant stem cells. Doc, don't look at me like I'm crazy. This is what they had on the news. And I started screaming, Gio, come here, watch this.
Ask for proof. There is no proof.
They're working on
it. Is that what you said? There's no proof, Gio?
You don't have stem cells. You have to
I understand that. They're saying that the stem cells are dormant.
But stem cells don't do anything anyway.
Doc, it's a
only
ploy
before
to
you're born.
sell.
That's how you get a liver, a kidney, a brain. The stem cells differentiate.
But then Stem
then-
Cell Institute puts a million commercials on the air.
Who's behind that? An orthopedic surgeon on every case. And I'm telling you, stay out of my business. They're in my business. I don't like it.
All I'm saying is, when you make an appointment at Stem Cell Institute, come see Dr. Pannozzo first. And then go see them. Because you won't need to see
Well, a lot
them.
of them come in afterwards. You know, they spend $10,000 on that, $5,000 on it. Then they come and see me,
Doc,
and I take their pain out
do
for
you
less
charge
than-
$10,000 now?
No.
Do you charge $5,000 now? Because if you do, let me know, because I want in.
Well, I got news for you. He could cure scoliosis, which everyone goes, huh? They wouldn't go, huh? I said, yeah. I've documented proof.
We
Not
have
one person,
video
not two
documented.
people. I have documented proof that this man can cure
We've shown
scoliosis.
it. We've shown the
Well,
twist
they're
and all that.
confused on what scoliosis actually is. That's the problem.
I-
If they ask me, I will tell them it's a scar tissue holding the bones crooked. You release that, and the bones go back.
And people
It
just,
works just like that.
they don't get it.
Well, you know, the
You know,
reason
how
they
do I
don't.
know all that?
The-
I have that expensive piece of equipment, right?
The C-arm.
C-arm, there you go.
I looked up what a C-arm costs, Freddie. With your house
50
and my
cents.
house,
I know.
a couple $100,000.
I know. And yours is hooked up to the computer now,
Yeah.
so we can receive the images. Is that true? The guy told me you could do that.
Yeah, but he never did it for
Well, we need to call him back.
Yeah.
Because I need those videos.
We need
I
those.
need those.
Well, I'm putting them. I put them on. Well, there's no videos. I put them on my camera. I take pictures. Now
Well,
that we could put into.
We're going to
the-
put that. We're going to start showing more and more
Yeah.
imagery,
Yeah.
so that people can.
And it's really there, and you say, how is that possible? Well, you got to know how to do it.
Well, you've been doing this for a lot of years. You know, someone once asked me, said he went to Ohio State University. I see everything he did. He's dissected brains. Why did he go into musculoskeletal? I mean, just and not surgery.
Well, because I didn't like to dress up and hang around in a cold room forever.
Yeah, why they keep it so
I mean,
cold in there?
I would not live in an apartment with many floors that you have to do an elevator. I want to close my door and walk outside. You know, that's the way I am anyway.
Okay.
So musculoskeletal, when I come out of school, was not understood at all. So everything I'm doing is
Self-taught.
I was going to say self-inflicted.
No, not self-taught.
Self-taught, based on what we see in the C-arm and based on the anatomy, design and function. You got to remember, these are engineering terms. Design and function. God made us. Why? How is it supposed to work? If you don't believe in God, I don't know how we got here. Anyway,
That's another one.
Spoken
We'll
like
talk
a
about
true
that. We'll
scientist.
talk about God next. Hold it.
So,
right there. Here you go.
so design and function, you have to understand that. So it's designed to work a certain way. What goes bad? Where is the pain? Pain's never in a joint. It's always outside the joint. You got to remember that. So there's all of these kind of things that we talk about.
So you study physics also.
And physics, the physics of weight bearing. How do you get your weight from here to there? It's a weight bearing problem. It's a physics problem. See? So all of these things come into play when you're dealing with musculoskeletal. Plus, the reason I went into it is because nobody was doing it, and I wanted to make some money, so that's what I did.
Okay, let's again, New York. Thank you so much for writing in these calls. So here we go. Doc, Eric from New York City writes, I watched your show on Manhattan Cable, and I had to go to your website to see if this show was real. I have never seen the show before.
I mean, she's honest.
Yeah, well, I like that. We'd rather have people that are honest. Okay, I lost my train. Oh, I've never seen the show before, and I wanted to ask if any pain treatment can be fixed with your procedure. Can you explain how in one visit you find where the pain is located, and then with one shot it goes away? Do you use Novocaine or a painkiller? See, New York people really want to know what the heck's going on. All right? Am I right? They want to know.
You should see some of the questions are 4 pages long.
I'm glad you cut them down.
I mean, Doc, some of the stuff that we get from New York is like so long.
We're from New York. We always ask questions. Is this pretzel fresh?
That's right.
How
Is
long
this
has
a
that
real
hot dog
pretzel?
been in that steam?
Where'd that steam come from?
Okay, so, right? The steam's coming out of the hot dogs. It's been there for 22 years, and they taste fantastic.
That's what's the secret.
Okay, go ahead, Doc. I'm
I
sorry.
thought it was the mustard.
Oh, no, the hot dog. Well, it's a nice warm bun. The hot dog, put a little
It's
sauerkraut
the
on
water.
it.
They don't change
Oh,
the
you're
water.
talking about a hot dog. I thought you started
They
with a
don't
pretzel.
change the water.
And you want to something like no one's ever gotten sick from New York. Have you ever gotten sick from
Never.
New York hot dog?
Never.
Okay,
That's
you-
because I have all those enzymes.
Okay, I think we ought to answer the question now. What do you think? Question. The first part of the question is.
Well, you have to be able to take a history, and you have to do a clinical exam, and then you have to do a special film that we do, and then you have to put it all together. So you explain to people that this is where your pain's from, and this is why it's there, and this is what we have to do to correct this. And if you say, well, it's 2 shots, 3 shots, and if you say no, you lose. If you say yes, we go right over to the C-arm, visualize it, and you're done. 5 minutes.
And the beauty of that C-arm, it shows you just where the pain is.
No, it just tells you where the anatomy is.
The anatomy,
you have to know where the pain is.
He's going to find the pain,
Right.
but he has a roadmap to look.
Oh, yeah, that's which no one.
Yeah, so there's no way to teach someone rote out of a book. You have to understand the physiology of design and function. All of these things we talked about, design and function, the physics of weight bearing, where the pain is, where it's not, and so you can put it together for somebody, and we actually do that. It's amazing. I even amaze myself sometimes. I mean, truly.
No, I
mean, how good this is. This is really top of the line stuff, and there's no mistakes made. This is perfect.
And you don't leave that office until that pain is gone.
Yeah.
And you guarantee that you'll make it gone.
Yeah, if you say the pain's not gone in 2 minutes, I said, well, wait over there, a couple more minutes, and if we have to, we'll go back in. Maybe I missed it. Well, people don't wait. They wait to 5 minutes, then they leave because the pain's gone.
And what you do is you try to, which to me is the best thing. He tells you, reproduce the pain. When you bend down, I want you to bend down.
Yeah, that's the most amazing thing.
That's the part.
Les. I tell people, try to make it hurt now.
Yeah.
And they say, nobody's ever asked me that. Well,
No.
who are you going to? I mean, you have to prove your point. I mean, I prove myself every day of the week. Every
right.
patient that comes in, I prove myself knowledgeable. And I say, try to make it hurt. And it was so, I don't know how. I said, well, it's in your clinical exam. You were hurting by going forward. Okay, go forward. Yeah. And they go forward, no pain. I say, okay, well, that's your.
I saw the golfer that you did, and he said, "We tried. Go back and make that." And he went back and said,
Yeah, we go.
Holy shit! Ooh, oh,
If it's a
I'm
golf-
sorry.
She dumped it.
If it's a golfer, we go back to the golf swing.
Thank you. Yeah.
So we'll make you have a normal golf swing, like the way you were born. When you swing, it's a natural swing. Anybody who's operated or has their swing changed by a PGA guy is wrong. You don't change the swing. You go
Well,
back to
Tiger
normal.
Woods is your perfect example, the world's greatest golfer.
Yeah.
Well, people understand if you're on pain medication and you're going to come see Dr. Pannozzo, don't take your medication in the morning.
No.
If you have an appointment with him, come raw.
That's very smart. Yeah,
because
that's a
if
good
you come
idea.
with medication, he can't help you.
Yeah, that's a good idea.
If he can't see the pain, he can't help you.
And if you want to know what I'm going to do, just read the book.
Yeah.
The book doesn't tell you anything that's solid. It gives you ideas.
Right.
If you're going to go to a chiropractor over 4 visits and they don't take care of your problem, then don't go back because they don't know what they're talking about. Don't go for a year and say, well, they helped me. They didn't help you for a year.
The chiropractor will say, you got to come back. It gets
Right.
better.
Because there's certain diagnoses that they cannot treat, and that's what we do for a living. We give you the proper diagnosis, and it's proper because we treat you based on that. So it's not by accident. This is all by plan, and it all works out just the way we're saying.
Well, one of the things when Fred brought up the chiropractor doesn't know where the pain came, and it might not be with the adjustment of the bones. It doesn't get rid of the pain where you have.
They can't get to it. See,
No,
they can't
exactly.
Get to, even if they knew,
Right.
which they don't.
And they keep you coming back and back and back and back and back and back. My
Well, as
brother
long
went
as
to a
you're willing to
chiropractor
go,
forever.
they're willing to take you, of course.
Well, okay.
Read another question.
I certainly will.
Did I answer that one?
Almost.
Good answer.
You were
good answer.
close.
No, that was a good answer.
Yes.
So there's no Novocaine, none of that stuff.
No. He gives you a FDA-approved medication, so I just want to it's the only steroid that the NFL does not have on their list.
Yeah, it's completely anti-inflammatory. There's no muscle buildup from
Right.
this. Nothing at all.
Lisa from New York City writes, I'm 6 months pregnant and have terrible pain in my hip. It's gotten so bad that going to school and working is becoming really, really, really hard. I'm planning a trip to Florida in about 2 weeks for vacation. I wanted to know if being pregnant would prevent me from using your procedure.
That's
No.
a good question.
That is a great question.
It's a great question. The reason is that the medication is short acting. In other words, in 9 hours, it's all gone. It cannot affect your baby whatsoever. Your baby's a human, too. It can tolerate just like you do. So, no, there's no downside to it. As a matter of fact, you should have it done, should get that pain out of there because it gets worse in delivery, and you don't want to be suffering. And with the medications they give you, affects the baby. So you want to get rid of the pain without medications.
Well, wait a minute. This is a brand new area.
Yeah.
I never even realized. If you're pregnant and you have a bad knee, there's nothing that doctors do for you. They says we don't want to give you anything because of the baby.
Right.
And here you have an MD who can help you and not affect the baby. Correct.
Right, absolutely right.
I mean,
Wow,
this is
that's amazing.
this is an answer from a medical doctor. I mean, just let everyone know he's a medical doctor.
Yes.
And what Lisa also says, I guess you answer the question, does she have to wait until the birth of a baby?
No.
Okay, so Lisa, let me give you Dr. Pannozzo's number, and you could call him up right after the show. The show ends at 12 o'clock. His direct number to him is 561-381-5800. 561-381-5800. If there's any other question you want. In fact, you can call us up right now, Lisa, if you're listening to the show toll free at 800-889-0267.
Now, Les, okay. The obstetricians will approve this
Okay, you hear that, Lisa? If you heard that, yes.
because
Okay.
they know it's not going to affect the baby in any way.
Right.
That's
I mean,
pretty
so
good.
yeah, that's fantastic.
It is a top of the line. I mean, any pregnant woman who suffers is. I mean, I hate to see it because it's totally unnecessary.
And they're going to suffer as they get bigger, and that pain is going to get worse.
Right.
Next one, we got Jackie from New York City writes, I've been scheduled to have hip surgery in 2 weeks, and I've been told to have one hip done at one time. My lower back pain and the pain in my leg is the reason I'm having surgery. Let's take, okay.
I mean, you don't have surgeries on both hips at the same time, do you not?
Well, sometimes they do.
Really? Holy mackerel. The pain must be unbearable.
Oh, I know.
Well, the recovery is
It's even worse.
unbelievable.
My
bad.
brother-in-law, before
Well,
I
first
did
of
the
all,
show,
you never get operated for a pain. Okay.
That's a good point.
Especially the hip, because the hip is never the issue. It's the capsule around the hip that's the issue.
And they replaced the hip, doc, in surgery? They
Yeah.
replaced the whole thing?
They replace the whole thing. And so if you have a pain after that,
Scary.
they'll say, well, it's a failure, they're moved, you got to redo it again. No, it's just scar tissue because this is brutal surgery. When they cut a bone out, I mean, they are filleting your thigh like that. And then they have to put it together. So how do you put it together? You want scar tissue to form for stability. But that's where the pain is. So we could treat that. But don't do it in the first place. See me first.
Yeah.
And if one hip is bothering you, you have to ask yourself why that one and not the other one.
that's really sad.
That's a
You're
good
right.
question.
Yeah,
So
it's a question, right?
it's a dynamism. Why is one hip bothering me and not the other one? Okay. It could be that you fell on it. It could be that you have a scoliosis. It could be a referred pain. You see, all of these things are possible, and that's how we look at it, and that's how we diagnose it. So if you have one hip bothering you, don't get both of them operated at the same time. They do both knees at the same time. I think that's criminal.
Well, I have a relative before I started working with Dr. Pannozzo who had hip surgery. Let me tell you, after it was, I mean, he was really a nasty guy. He had to take a medication to calm him down. The pain, he said, was so severe, he couldn't go to the bathroom. He was on medication. And he said then afterwards, the therapy, he said the therapy was worse than anything he's ever seen.
Yeah, the therapy is worse.
Oh.
I don't know how the physical therapists put up with this.
Well, let me get some more
I
of this
don't,
question.
because they don't have an answer to it.
Jackie from New York also says, I've heard you say that surgery can bring more problems than the surgery can cure. I need both hips repaired and want to ask what is the procedure do you do both hips? Well, that's a question.
How do you work on both hips?
Yeah.
I think it's what she's asking.
Well, he said, okay, how does...
Well, first of all, we find out why the hips are bothering, why
Okay.
they're hurting. And it's usually one worse than the other. So you have to understand the dynamism of weight bearing. How does the body bear weight? Why does it hurt when it bears weight? And then you just reverse that process. You go right at it. We do our special film, find out where the stresses are, relieve those, and take care of the hip. Now, A really bad hip, I mean, with no motion at all, would take me 3 or 4 visits to fix.
Wow.
But that's better than having your body operated. I mean,
Hey, Doc, is there anything such as a degenerate hip?
no,
Can you be born with a degenerate hip?
cannot.
Harry Anthony, if you're listening to me, my nephew, because he's watching, there is no such thing as a degenerate hip. They
That's
want to
right.
operate both hips.
That's right. Don't
He'll
do
be
it.
out 8 months.
Don't do it. This surgeon wants to make a
Wow.
lot of money real fast.
Wow.
Don't do it. I'm telling you.
Well,
You'll have a
you
lot of
answered.
trouble. And you know what? The biggest thing is he's not going to be able to get to that surgeon again. If he has a problem, he'll never get to him. They will not bring him
Send
in.
him to somebody else.
They'll send him out to the therapy. They have no answer. See, they don't do this kind of work. And your nephew should know that.
Well, here's what Jackie of New York said. How long would he have to spend in Florida?
For both hips?
Yeah, with you.
Well,
Could be a couple of weeks.
Well, first of all, you got to have 1 day to
Yeah.
be examined,
Right.
and then after that, it's 2 days later, and you're out of there.
So a week. A week to 10
or
days.
less.
How's
Yeah,
that?
it's a nice vacation week. Yeah.
That's right. Unless it's going to hook it all up with
You, Jackie, you call up, and you call up Dr. Pannozzo. He'll send you to me, and I will book everything. Get you a nice hotel right on the water. Get you, and it's not that far away from the dock. It's maybe 10 minutes. You think 15 minutes from.
not even.
And you know what? You will be so happy that you don't have to go in for hip surgery
Well, the nice thing is you're going to see Dr. Pannozzo,
and be in Florida.
and then you're going to go out and do something fun. It's not like you're going to be in a rehab hospital bed.
Could you imagine this, Freddie? Picture this: a guy with 2 bad hips can't probably sit in the plane. Comes down to see Dr. Pannozzo. The next day, comes to see him again for another shot, and then he's out walking on the beach.
He's at
Beautiful
Orlando Walt Disney
It's a
World.
whole world.
Yeah,
Boy,
they can go to Tremonti's. It's the best Italian food that you could get. I mean,
can we
it's
mention your name
absolutely-
and maybe get a discount?
Absolutely fantastic.
Didn't
I
answer that,
don't
did he,
know
Fred?
about that.
Didn't answer
No,
that.
he didn't answer.
Not to pay full price. But I mean, just imagine how you feel. I mean, to me, in Jewish we have a word, it's a machaya. Means, my God, I'm normal. I feel great. I mean, what's better than that? Not having to sit in a hospital. I mean, you sit in a hospital, and now when they do hip surgery, you're out the same day.
Right?
That's right. You're not in a bed. You're doing something great.
Okay, let's get some more. These are some great questions, New York. Thank you. Larry from New York City writes, I watched your show twice, went to the website to see if I was hearing everything truthfully. I called my parents who are retired in Boca Raton and asked if they knew who you were. They quickly answered that they had heard of you, but had never gone to see you. They have since watched and heard your show, and now I'm ready to visit them because I have to. I have bad migraine headaches that do not stop. The 3 of us have issues with different things, shoulder, foot, my migraine, but after visiting your website, we want to know how long have you been doing this? I'm sorry. And have you ever had a case of migraines that did not go away?
No.
Okay. So let's, how long you been doing this?
They all go away. I did the original research on that. I even went to the medical school
Right.
and dissected a body to find out about this.
Yeah.
It is absolutely foolproof, no downside. Your headache goes away the minute I do it,
Permanently, Doc?
permanently.
You've never had anybody come back?
Not
I
yet.
come back on the other side, but,
Yes, we talked
but
about
not the main side. Don't forget there's 2 sides. Well, it's a technical thing.
I told you before, what's your name? Who did I just read? Larry, I sent somebody in who was a very good friend of mine who went to every single doctor that you can possibly go to, who are, quote, you see my quotes? Quote, experts. I had to actually twist her arm because she didn't want to go to another doctor and get a shot. As she walked into the office, there was a lady, must have been about 70 years old, who had just got finished with Dr. Pannozzo. She had gone on one side, came back to the other side, who said to her, the best thing I've ever done. She said, you know how much money I would have saved? I have not had a migraine headache since this man has. She took the shots, and not only did he cure her migraine, he cured her vertigo. Okay, so all you people that are going to the doctors, the neurologists, I'm not saying they're bad to get those little things in your ears. I've been looking for those things in my ears. I can't find them. I used a Q-tip. Where are they? Where are these little things that you have to balance your head to get
No,
migraines going?
the whole thing is nuts. I mean, it just doesn't happen.
doesn't sound-
I came to medical school like everybody else.
Yeah.
This is what they teach you, and I'm telling you that I did research on this. It's 100% effective. Try it. What do you got to lose?
Go to our
you gotta lose a
website.
half hour of your life.
Yeah. Go to your web. Well, it's a half hour to
Now,
get
we
in.
had 2 people who I had to do. There's 2 sides to migraine, you know. One was a professor at the one of the universities in Boca, and we did one side, but she had a bad neck. Oh my God, it was terrible. So she came in a month later. We did the other side. Haven't seen her since.
Yeah.
And now we had a motorcycle rider.
Wow.
Like this. And I
Do
did
that
one
again.
side.
I like that.
I did one side, and he came back the next day. He said, "I want the other side done." I said,
Migraine or vertigo?
"Migraine." And I said, "Okay," so we did the other side.
That's dangerous to have a migraine and drive a motorcycle.
How about vertigo? Of course,
Oh, forget about it. You can't do it.
So, Doc, most people that have migraine headaches, they have tendency to have vertigo also?
It's from the same spot,
Right.
so you can have it. Yeah.
So here's what someone told me, Freddy. Ready for this? My doctor said if I have to stop eating liver, stop drinking certain kinds of juices, and stop eating chocolate because that's causing my migraine. And I looked at him and said, "You're wrong." I said some other words, but I can't do it because I'll get bleeped. Okay? I never heard of food causing migraines.
Listen, the public should understand this. Let me go into this. Mechanism of disease. You got to understand mechanism of disease. That's the way I think.
Mm-hmm.
If you have a disease, you have to know why you have it, where it's from, and what do you do for it. That's a mechanism of disease. Now, you had a headache, it's the same thing. It's a mechanism of disease. Why do you have it? Where is it from? And how do you get rid of it? Now, we do all that for you, but that's the thinking that goes on when you're taking a history and a clinical exam. You know, it's just not talking to somebody. I mean, this is a clinical situation where everything you say means something, and every question I ask you has a meaning to it. It's not just at random. And so that's the way we look at it, mechanism of disease. So we'll explain it to you, why you have it, where it is, and what can be done for it. Try it. You got nothing to lose.
Oh, you got nothing to lose and a lot to gain. I know what it's like to have migraines.
Absolutely a lot to gain.
Okay, let's go. I got to get Atlanta now, Freddie, because they want to know. Thank you so much.
You should, because he's number one in Atlanta.
Number one. Okay.
Your show's number one on those 2 stations up there.
Yeah,
Number
2
one in
stations.
Atlanta.
Okay, Atlanta, here we go. Sarah from Atlanta writes, how can I remove the pain in my shoulder that I hurt during a skiing trip about 2 years ago? My right shoulder was dislocated while I was on a slope, and it still feels like there are stones in my shoulder. What would it take to get rid of this pain? And is there a solution, something that will work?
Permanently.
She didn't write permanently, but permanently, yes. Yes.
Yes, the way we examine a shoulder, we're not looking for tears and all that other stuff that you hear about. That doesn't happen. You have a bad sprain. And so what happens when you have a sprain, the repair that the body does is to contain it and tighten it up so you don't move it. And that reduces the pain. But it also reduces your mobility.
Mm-hmm.
So how we look at it is, where's the scar tissue? We loosen that up and your pain leaves.
Also, atomic hoppers are going to help.
So it's no.
So she has scar tissue in it from the dislocation?
Inside the joint, yeah.
From dislocation?
Yeah, from the dislocation.
Is that instant?
No,
that happen?
it takes a while to produce that, like 3 weeks.
So then she's had this pain
And it
2
doesn't-
years.
Yeah.
It's going to get worse.
Yeah, it does not improve, and that's a good point you're making. The shoulders do not improve.
Hey, you heard that? Doc says I made a good point.
Yeah, you did make a good point. I mean, come on, you're a bright guy. You were a coach. My God, you coach people.
Can you imagine this man, what he would do in the NFL
Oh,
with all these
God.
guys? I don't even want to think about I mean, foolishness.
There'll be no time off.
But it's foolishness what they're doing.
I mean, if someone had a groin injury, you were a coach. They were out how long? 2 weeks? 6 weeks?
6 weeks.
Okay, I had a groin injury. I was out in. Oh, I got a call from Palm Beach. Hey, Karen.
He doesn't. You see the way he
Hello,
reacts?
how are you doing?
Hi, you're on the phone with Dr. Anthony Pannozzo.
Very good. I have a question. I have a family member here, and I've called him before, and he's looking at he's going in for a diagnosis tomorrow regarding knee surgery. He's going to his surgeon, and I know you do second opinions, but if I understood you right, you said there are cases sometimes when you make diagnoses, and you find that you can't help a patient, and I was just wondering what types of situations those are and why you wouldn't be able to help them. Is sometimes pain not caused by a tendon issue, or he's had a bowed leg for a long time, and I'm wondering if he's had bone rubbing on bone, and that causes some of the pain. And
Yeah, like a cowboy.
yeah, like a cowboy. That's
Well,
what he looks like.
he has scar tissue on the inside of the knee. And that makes the outside of the knee stretch out every time he walks.
It's
So
his
he's
left-
walking, boom.
It's his left leg. He had a sporting injury when he was a kid, and he's had it for how many years?
Yeah, well, there's what you have to concentrate now is where's that scar tissue now? It's on the inside of the knee. I don't know. I don't have a knee picture here,
No,
There's no knee picture.
but that's treatable. We treat it all the time, and so that comes out gradually. Comes out. No surgery needed, especially if somebody's young. You don't want a young person operating.
He went to your I can't say the word, but he went to Ohio State.
He went to Ohio State?
Oh, he's
All right. Buckeye.
He's an alumni. And he's had this condition for I don't know how many years.
2 years out of high school.
But how many years is that?
So it's a little while ago.
79, 2 years out of high school.
There you go.
Well, it really doesn't make any difference. You have to know where the scar tissue is, and there's a treatment for that. You don't necessarily have to be operated unless you want to. I mean, that's a
No,
perfect.
nobody wants them.
No.
I mean, I wouldn't.
No, I
But-
told him
but it's all treatable
try to
stuff.
leave
He's
the
got-
invasive thing versus not a.
Yeah, he's got to make an appointment and get examined. Then he can make up his mind
Yeah.
whether he wants to get a surgery or he wants to try this other thing.
Yeah.
You never know.
You know, to me, we've been doing this show for quite a while. It would behoove you to at least bring him in and let Dr. Pannozzo do a diagnosis, and let you guys decide. I mean, if you don't want to do it, it's up to you.
There is
Yeah,
no
does
need.
normally a condition like that does it involve just a couple of injections?
We
or-
don't know because we don't know what he looks like.
Yeah.
Now-
well, it's very bowed. So I would
okay,
imagine
well,
Now,
it would
is
take
it-
a little
that
longer.
boldness is the scar tissue. But Doc, as soon as you get that out of there, this guy's going to grow inches, correct?
Well, he'll grow a little bit, and we also can do a shoe modification. Anything to get operated. You never want to lose what was created before you were born. Never lose a joint.
So after the first injection for something like this, it'll just release a little bit of the scar tissue, and then
It's a mobilization of scar tissue. We do not treat the inside of the knee. That's not
yes,
necessary.
yeah.
It's
So
on the
I
outside,
imagine each injection it loosens up the tendon a little more,
not tendon, ligament.
the ligament. And do
Totally.
you use cortisone? Do you use cortisone, or I thought you used some sort of a steroid?
We use a steroid because that's all there is.
Okay, because I heard somebody say use cortisone.
No.
One of those websites, and
Nobody uses cortisone.
that's what it said on it. He uses cortisone, and
No.
he'll wreck you. I mean,
You don't want to use cortisone.
Not true. This is the top of the line stuff. If he doesn't take advantage of it, what can I say?
yeah, but like you said on the websites, it's very difficult because they only have some of them only have a couple reviews, and it's,
Well, no. He's looking at it wrong. The website is only to introduce me. The actual work is not done on the website. You cannot judge what I'm going to do from the website. It's
Well,
only information. That's all it is.
yeah, I just looked up the website to try to get some information and directions and everything, and of course there's reviews, and you don't know who's passing on those reviews, but I thought you said you had a website too where you actually show procedures being done.
Yes.
No, we don't show procedures.
We show what the results of what Dr. Pannozzo. If you go to Pannozzo, PANNOZZO.TV, you could see actual patients that have gone to him and people who have had
Scoliosis is
Yeah.
on there.
Yeah.
The
Pain centers nationwide or Pannozzo.com.
Or go to
Okay, well, I
Pannozzo.com.
did that, and
We'll
what
give
I
them
saw were
go to-
Google.
No, she went to that
what
one.
I found on there were the previous radio shows you did.
Yeah.
I didn't see one about the what you're talking about now. I'll have to go back and look.
The
I don't have a
Pannozzo,
computer. I go to the library.
Pannozzo.tv,
so-
Pannozzo.tv, you go on there. HIPAA will not allow us to put procedure on there. What
Not
he
allowed.
has is someone who described what she went through, and you can see the turning of the bones
Right.
on the scoliosis. But
Okay.
in his case, what you're going to get in your husband or your father's case, what you're going to be getting here is a different procedure. At the beginning of the show, we talked about how everybody is treated differently. So this is a custom-made treatment. When he comes in, you're going to be very happy with this man.
Oh,
And I'm
God,
telling
yes.
you this as a patient.
Are you talking about the scoliosis patient from England?
Correct.
Oh, okay, I did see her. I did
Okay.
see her.
If you look at that and you look at what she went through, she's
Yeah.
70 some odd years of age. In there, you're going to see the bones turn because he took care of her. She grew an inch and a half.
Now, if I understand, she had a 50% correction.
Yes.
the
Yes.
a curvature of the spine, which was pretty amazing considering how bad it was when she went in.
Yes, it was.
So, okay, but sometimes it's not like 100% straight afterwards.
It can be.
Just make an appointment. We have to go to the
It
next
can.
question.
It can be.
Yeah, just let me give you the
But
appointment.
come and see him. Give her the address.
561.
Okay, will do. All right, well, thank you very much.
Thank you.
Okay, have a good day.
Okay, we got one more. We got a question from Atlanta. Mike writes, I tried to find someone else that does what you say you can do. There is one who can do this. There is no one that can do this procedure. Are you the only doctor who does this type of cure? And why isn't the medical profession doing anything to correct this? How does the insurance companies treat your procedure for payment?
Well, they pay.
They pay. Simple as that, because they know it works. Doc, again, we get into these things where our time is running out. We got 2 minutes left. Anyone that wants to see Dr. Pannozzo, his number is 561-381-5800. You can make your appointment, talk to the doctor on the phone. If you want to come, I can't give any more questions, Doc. We got 1 minute.
Got 1 minute, Doc.
It takes me 1 minute to read the question.
We'll have to ask those questions next week.
Next week, I've got 2 pages from New York and from Atlanta. Thank you so much, Doc, for doing what you do. Freddie, thank you for doing what you do. And Linda, thank you for, I got 2 minutes. Oh, Doc, I got one fast with him. Mike from Atlanta writes, I try to find I read that one. Jolly from Atlanta writes, I've heard your show a few times on radio, and I never get the phone number to call in the show. Okay, I want to ask my son, who's only 14 and has a huge hump on the right side of his back. He doesn't play sports or go to the pools. How could you help him and change his life?
We know where that scar tissue is holding the bones that way. We'll treat it, and it'll come right out in front of your eyes. I mean, I promise you, there is no reason why a 14-year-old has to have a curvature.
So, Jolly, call up 561-381-5800. Talk to the amazing, and I mean amazing, Dr. Anthony Pannozzo.
Yeah, do not go to a surgeon for this problem because they'll want to put a rod in there. Do not do that. You don't need it.
A rod will just ruin your child's life.
Ruin it.
So, again, now I want to say to everyone, thank you, Doctor, as always. Tune in Sunday. It's not a comedy show, folks. This is real stuff. Freddie, Gio, Linda, thank you all again. 561-381-5800 and change your life forever. Thank you. See you next Sunday.
I like that. Change your life forever.
No, Doc, I'm not just a pretty face.
This has been the Dr. Pannozzo Sports and Medicine Hour with Dr. Anthony Pannozzo. If you spend 5 minutes with Dr. Pannozzo, you'll see he genuinely enjoys helping others. Visit Dr. Pannozzo online at www.paincentersnationwide.com or call him at 561-381-5800. Dr. Pannozzo will consult with you to determine the best solution to your pain needs. 561-381-5800 is the number to call, even if it's just for a second opinion. Join Dr. Pannozzo next week when he brings you more important information on the physics of weight-bearing and engineer concepts for the body.